Just a quick reminder of who I am for those of you who are coming today for the first time. My name is Caroline Kotze, and I am the president and founder of Women in Governance, a nonprofit organization for the advancement of women. We work towards bringing women to the executive level, to boards of corporations. We will begin with the first plenary session of the day called Using Data to Inform Decisions. And allow me to introduce our panelists. Ibrahim Dabes, Director of Metrics, CanWatch, will be the plenary moderator. He is responsible for the promotion and use of common measures and core RMNCAH indicators and methods consistent with international best practices and in alignment with health reporting tools to enable enhanced and coordinated tracking of key development results towards improving women and children's health globally. He has over 20 years of experience in global health and has held many positions in the public health domain. Peter Bertie is Deputy Director, Nutrition Advisor, HealthBridge Foundation Canada. He is responsible for ensuring the technical quality of all of HealthBridge's work in food and nutrition research and programming. Much of his work has been in the Americas, where he has conducted research and managed programs in food system research, nutritional assessment, and food fortification. His work emphasizes nutrition-sensitive agriculture and food systems. He brings to his work a command of data analysis, which enables novel insight into program evaluation. Rudy Brouwers is Director, Monitoring and Evaluation at Plan International Canada. He is an expert with more than 10 years of experience working in international public health and education programs. His portfolio with Plan International Canada focuses on MNCH and sexual and reproductive health and rights. Vaughn Lance is Director, Program Effectiveness and Coherence, Global Affairs Canada. He's responsible for planning, systems, and coordination related to the implementation of Canada's feminist international assistance policy. His division also leads the development and implementation of results-based management tools for the department. In previous positions, he has managed both multilateral and bilateral programming for the department. He was responsible for economic policy as well as development programming with the World Bank, International Monetary Fund, and regional development banks. Abaina Thomas is Grant Manager, M&E Advisor at Enrich World Vision Canada. He's a public health specialist with over 10 years of experience in HIV and AIDS, infectious disease, as well as maternal, newborn, child health, and nutrition programming. She is currently the Grant Manager, Monitoring and Evaluation Advisor for the Enhancing Nutrition Services to improve maternal and child health in Africa and Asia with World Vision Canada. Her interest in health systems strengthening has led to a focus on capacity building and development of tools and strategies that facilitate improved program implementation. Your panel.
Okay, thank you very much. So we have an exciting session this morning, and the way it will run, we will start with Abaina, and we will start talking about the project level monitoring and evaluation and data aspects of specific program level metrics. Then Rudy will talk about issues relating to poverty and vulnerability and metrics and measurement around that. You've heard some hint of that yesterday in yesterday afternoon's presentation, so he'll go into more details about that. Then Peter will talk in defense of data. We'll see what that means. And finally, Vaughn will take us to the higher level monitoring, evaluation, the use of data for evaluation and learning within the larger scope of government within the framework of the SDGs and the feminist international development policy. There will be plenty of time for conversation and for questions and answers. So think of what you want to ask for the panelists, challenge them, make them sweat, and have fun. So, Abina.
Thank you. And it's the green button, yeah?
The green button, yeah.
Excellent. Sorry, go ahead. Awesome. Well, good morning. Thank you so much for inviting me to speak. And I'm really happy to kind of continue that little bit of a helicopter ride that Michael was talking about yesterday. We're going to hover a little bit on a specific project. We mentioned it, or it was mentioned in the introduction, enhancing nutrition services to improve maternal and child health. So I want to hover around that project, but really get into what we're doing around monitoring. So, that one. Wrong green button. All right, so looking at the Enhancing Nutrition Services Project, or ENRICH for short, it really is looking at addressing under 5 mortality, maternal mortality, through nutrition pathways. We have 4 great partners in Harvest Plus, Nutrition International, University of Toronto, and Canadian Society for International Health. And we're looking at addressing issues of demand, supply, and enabling environment. So when we talk about supply, we're looking at service delivery. What are the nutrition-specific or nutrition-sensitive, gender-responsive services that are being offered at facility level and community level? Then on the demand side, what are the community, household level knowledge, behavior change, production issues involving things like biofortification, small-scale animal livestock for diversified diets. How are we creating that demand for improved nutrition and health behavior and knowledge? Then finally, we have the enabling environment, where we're looking at policy and curriculum around nutrition. We're also looking at policy around health information systems and management. So it is a multi-sectoral integrated project looking at all the facets that deal with nutrition and health. And by saying that, I'm also saying it's complicated. And when complication happens in development work, and that complication means that we have to find innovative ways to monitor and evaluate. So, everybody's kind of seen this timeline. It's a typical timeline of a standard project. We have our baseline, our midline, and our final evaluation. I believe it was Tangina yesterday that talked about we need to actually get more information more quickly. So that's what I'm going to talk about. How have we found ways to get data that help us make decisions more quickly? One of the things we have done in our partnership with the University of Toronto is ensure that we're getting quality data. We've introduced comparison sites in 3 of our countries so we can do a double difference or a difference of differences sort of evaluation. But that still does not address the need for concrete decision making, so in shorter bursts of time. So our observations, the challenges and potential solutions around that, one first observation is context change. From the submission of application to the actual startup of intervention, there's a big time lag and nothing stays static. Change is the only thing that is constant. So our monitoring and our evaluation needs to adapt, and our programming needs to adapt. So the other thing that we've observed is we have to have common definition and common understanding of how we do monitoring. For example, if we define immediate outcome level data as being changes in access as well as changes in knowledge, how do we expect to get that information? Access is a little bit easier. We have health information management systems. We have health records. However, changes in knowledge, when we think of nutrition, understanding around exclusive breastfeeding or appropriate complementary feeding. How exactly do we get that immediate outcome level data without having ways to do household level surveys? So that's one of the observations that we've made, and we were trying to, what we actually did is negotiate to extend our semi-annual reporting timeline for immediate outcome level data to annually, so we could introduce a really quick, cost-effective survey methodology that I'll introduce to you. Another major observation, and I think this is common to all, this isn't something brand new, is our output and activities tell us what we're doing, right? But they don't tell us whether what we're doing is the right thing to do. So again, we need to start analyzing at that higher level, that immediate impact level, in order to ensure that we're going to reach our long-term goal impacts. So all that to say, the solution or the tool that we are using in our project is annual outcome monitoring, and we're using a methodology called lot quality assurance sampling. It was developed by Professor Joe Valadez, and it really allows us to do quick, snappy assessment. It's simple, it's cost effective. It does not require difficult data collection. It does not require difficult data analysis. It doesn't require a statistician, and my non-statisticians in the room say amen to that. But it really allows us to use actually paper and pen to do analysis, addition, subtraction, division. We can put data collection and interpretation into the hands of frontline workers and staff so they can use that for decision making. You'll see on the right side of the slide, we talk about supervision areas and coverage and our overall catchment area. And this is the example of what that looks like. In Bangladesh, we are working in Thakurgarh district, Bangladesh. And within that district, we have 5 sub-districts. So our whole district makes up our catchment area in the world of LQAS, and each of our sub-districts makes up a supervision area. So what LQAS allows us to do is collect data from our individual supervision areas, aggregate it, identify our overall coverage for an indicator, but then look further and look deeper as to which supervision areas are performing better or worse than the other. So how do we use all that information for decision making? I'm sorry that this is really tiny, but I think you'll be able to see the bright red and the bright green. But this indicator is actually looking at minimum acceptable diet. It's a composite indicator where we have continued breastfeeding, and diversified food groups, as well as meal frequency. So the first level of analysis for us, looking at this composite indicator, you won't be able to see the numbers too clearly, but that first row in the table is continued breastfeeding, and it's in the 90s in this particular district of Bangladesh. Secondly, we have diet diversity, and it's actually in the 50s. And then we go down to meal frequency, and it's back up in the 80s. So part of what we're training our staff team to do, and what we're working with our staff team to do, is look at that from just that information. What does that tell us? Where's our issue? Our issue is in diet diversity. So when we look back at our programming, our small-scale livestock or our backyard kitchen gardens, are they actually producing, and are people actually consuming? So that's question number one. Then when we go across and we see the individual supervision areas, you'll see some bright red in the second column. That actually represents Haripur sub-district. And we can see that in comparison to the others, it's not performing as well. So the question becomes, why, right? And on the graph on the bottom right, you look at a timed measure of what's happening with our data. In our baseline, we started at 38%. In our first year analysis using LQAS, we went up to 48%. So we've seen an increase in our coverage of minimum acceptable diet. However, when you look at our target, we even exceeded our target for year one. But follow the orange line, and we're not there yet. So the question is, over time, how are we using this information to make sure we get there? And one of the solutions to that is understanding what's happening in a lower performance area like Haripur and learning from other high performance areas. So this is the capacity building we're doing amongst our teams to make concrete decisions. So we have our monitoring databases, we have our output tracker, and then we have annual outcome monitoring. And as I mentioned, when we look at our output data, our activity data, it tells us what we're doing, right? It tells us that we've achieved, we've spent our resources. We can introduce implementation fidelity metrics that tell us that we're doing those things well. But so what? What did they achieve? And when we use something like LQAS, it doesn't stand on its own. It's quantitative information that lets us know maybe we're moving in the right direction. But after that, we still have to talk about the why. So part of my encouragement and some of the things that we're grappling with is how do we get to the why? Where do we tie into qualitative assessment? How do we bring that in? Because the qualitative gets us to gender norms, gets us to inequalities and barriers to health and to service delivery and service access that we won't find from just quantitative numbers. So we want to marry all of our quantitative data collection with that community engagement, that understanding of the deeper issues of why, because we may be using models that are appropriate, but the messaging within those models are not appropriate because they're not addressing the actual social norms or stigma associated with behavior. Or we may not be using the right model at all. So these are the things that we want to assess and understand so we are dynamic and follow that change. So finally, I'll say our goal as a project is to tell the story of impact. We talked a lot about that yesterday as well, looking at where we are starting and how do we get to that ultimate goal. So I can give you one example. In Kenya, I met a community health worker that was trained. And she was recruited by the community, very enthusiastic about the work that she was about to do. In part of that training and understanding of nutrition, she identified that even her child was undernourished. So those learnings became very practical for her, and she enrolled in Positive Deviance Hearth. And I was there for when her child graduated and had gained weight after being a part of those sessions. So those stories are very, very real. And we want to be able to tell them from beginning to end and make sure that we're moving together and we're moving towards our ultimate goal. I think one of the things that I'll throw out there, we are also using the LIST tool from Johns Hopkins University. And it's helping us ensure that we understand where our specific activities are contributing to the bigger goal. So we're using LIST to understand where certain activities, certain metrics that we're using address neonatal death or maternal mortality. And I think that's the positive or the great opportunity with using mathematical modeling. So that's how we're doing decision making. If you have any questions, please, I'd love to be able to talk to you more. Thank you.
So you said a couple of, like one thing at least that resonated with me. You said it twice, actually, in two different ways. So basically, it's important to do things right, but it's more important to do the right thing. So can you just elaborate a little bit more?
I think we have some standard understanding of the social determinants of health. We have some understanding of really cost-effective, tried and true methodologies for addressing health and nutrition. However, that exists in a context of a human, and that human exists in the context of a culture and a society. So even though the methodology and the approach might be tried and true, the nuance or the detail of what we're doing really has to address in a community where women's rights are not promoted. What is it about that culture that we have to address first before we see change? So we may know the models, but the models have to be contextualized. We have to adapt to the context in which we're working, and it takes time and it takes further investigation.
That makes sense. Okay. So with that, maybe Rudy can give a brief talk and we'll move on.
Good morning, everyone. I'm very happy to be here, have the opportunity to speak with you all, and to share the stage with these very esteemed colleagues who also share a passion for looking at and thinking about data. I think we've already had a bit of an opportunity here over the last few days to think about data and specifically in the health sector. I don't know about you, but I told my wife last night that Sophie Trudeau told me indirectly that I was a nerd. And I thought, you know, that was pretty cool, and that we should all really embrace our inner nerds, or a geek. Okay, yeah, I may have said nerd rather than geek, so I even misquoted her. But I think we should all be embracing our inner nerd, and to that end, I also understood that the number of slides that this team had on those people focusing on data exceeded the slides from all the other presentations combined. So just to say that there's a lot of focus on data and understanding information, and we all cared very deeply about that. The purpose of this session was to unpack data issues in the health sector. And I feel as though we've heard a number of times over the last few days about the importance of evidence-based decision-making and improved evidence around Canada's contribution to health. These are very laudable goals, and I look forward to listening to Vaughn's overall vision for the Government of Canada and global affairs on where we will be merging and thinking about data in a broader sense. I'd like to go in maybe a little bit more detail, and yesterday my Director of Programs, Tangina, had some forward-looking suggestions on integrating poverty and vulnerability into our assessments for better programmatic decision-making. And it's here that I wanted to focus some attention. Obviously, the link to programming and vulnerability for vulnerable populations, for what we call the most marginalized, has been enshrined in many of our guiding documents, including the FIAP and what we see here in the SDGs. It's become almost an axiomatic inclusion in our programming that we're talking about vulnerable populations, the most marginalized, and so on. I'd highlight here that with programming for the poor requires us to also know about the poor, most marginalized in the areas in which we work. There's unique gender aspects to be considered here. There's interesting design aspects of when we receive our projects at design phase versus when we start implementing in our projects, which can be years later, can be decisions made already for us in terms of where we might be working. So poverty and vulnerability is enshrined in many aspects and in many timelines. In two of our MNCH SRH projects, the two I mentioned here, one is the Bouchy Opportunities for Responsive Neonatal and Maternal Health, and our Strengthening Health Outcomes for Women and Children, which is a five-country project in Haiti, Bangladesh, Ghana, Nigeria, and Senegal. We've enshrined the language around working in favor of poor and marginalized communities. Therefore, we've worked to bring additional level of rigor to our measures of progress of these groups by integrating some poverty and vulnerability measures into our baseline and end-line questionnaires. So I think we all spend a good deal of time thinking about poverty and vulnerability. Many people in this room spend a lot of time looking at various data sets. And I think we all know that there's poverty headcounts, there's wealth rankings, there's a lot of existing tools. And just as a point of recall, when we think about the difference between poverty and vulnerability, what are we talking about here? Vulnerability is really this interesting issue of shocks and being prepared or having some preparation for future shocks, both from an individual and a household perspective. Obviously, and what we've already shown yesterday and will be reiterating today, there's a lot of correlation between the two. And I think there's maybe some unique aspects that we are trying to unpack and understand better with regards to vulnerability specifically. There are, of course, important gender aspects to vulnerability, which I'll be raising again. Since the health risks faced by any individual may not be the same as other types of risks. Vulnerability can also be specific to sectors. It may be different from a health perspective than it is to an education or a protection thinking. So the purpose of our vulnerability index was to try to integrate relevant indicators related to health, MNCH and SRHR. So the purpose was to integrate these aspects into our baseline, midline, and endline into our project. And there are two purposes. One, of course, is the purpose of understanding our population and understanding who our beneficiaries are at the baseline stage. As I mentioned earlier, there's a design phase, which may have happened previously, but you're looking to confirm the levels of poverty that exist in the beneficiary areas where you're working. And I think the second purpose is, are the improvements noted in your project disproportionately reaching marginalized communities? And that's the obvious one from an evaluative sense for those of us working in monitoring and evaluation. We're most interested to know, are we disproportionately reaching those populations? So there's a critical gender component here in terms of single mothers at risk due to having several children, having fewer resources. And of course, in many of our existing approaches and existing sources, there are existing, some of those aspects are already incorporated. Education level might be incorporated in existing socio-demographic data that you collect. So our purpose was to integrate education into a vulnerability indicator, a composite, to be able to capture some of the elements of vulnerability into an overall index. Many of you will know the Poverty Probability Index. It was formerly the Grameen's Progress Out of Poverty Index, which is a set of 10 questions used to establish a level of likelihood of poverty. PPI questions are mostly kind of observational based. They are asked of the woman in the household. We have a unique aspect in our baseline data collection, what we think is unique, but it allows not only collection of women of reproductive age, but also male partners in the household. These questions are focused on the woman of reproductive age when they're asked, and they touch on issues of ownership of various household assets, the nature of the home itself. The PPI, as many of you know, is intended, or is country specific, and it is updated on a periodic basis, but it is meant to be comparable in case your baseline, you started with a PPI, and your end line, there's a new index that was developed for the country. It is meant to be comparable in terms of its applicability. So it has applicability for a project running 5 years. I should note here, though, that PPI is not really intended to be categorized. It's roughly meant to establish a likelihood of poverty. And what we are forced to do when we analyze the data and associate the poverty data with our regular MNCH SRH data is you're creating intervals. And they're arbitrary intervals, arbitrarily setting an interval for very poor, for poor, moderately poor, slightly poor, et cetera, et cetera. So those are arbitrary levels, and then there's some analysis that needs to be done on that basis. Similarly, on a vulnerability index we developed for the show and born projects, covered both individual and household characteristics, which were scored roughly between 0 and 7 in terms of a categorization, again, between low, moderate, and high level of vulnerability. So maybe just stopping and thinking about who is a vulnerable woman in our population, or a highly vulnerable woman in our population. She may be widowed. She may be also a woman between 15 and 19. She may be have two or three children under the age of 2. She may also be a religious minority within a population. She may have no formal education. And as you'd expect, of course, that many of these women are also going to fall under the PPI poor index. And I think that correlation was discussed yesterday, and I think, again, it's highlighted here today. Not unexpected that we'd see that this correlation in terms of poverty vis-a-vis vulnerability is very relevant and real. And I think you'd note here that it's not to be unexpected. We were thinking even about the level of redundancy of the two tools, the two indices. To the extent that they're highly correlated, is there real value in understanding both? And I think we have project-specific examples. We'd be looking to understand in emergency settings, what is the purpose of the vulnerability tool? What unique information does each part of the index give us? So there's some interesting aspects that we're exploring and trying to better understand here. Again, the level of correlation here is interesting, and this is a function of all the data that we've collected to date from the baseline. Also, as the scoring and the categorization, while it may be adjusted, and we may be looking at emergency versus non-emergency settings, these primarily were data emerging from non-emergency project areas. My colleague Tangina pointed out yesterday that vulnerability was statistically associated with skill delivery amongst women in several of the countries where we worked. And that was based on a Pearson chi-squared on a p-value of less than 0.05. So again, what we see here is even amongst slightly poor populations, there is a good deal of unskilled delivery taking place. Tangina pointed out that this is an interesting finding because even amongst the relatively non-poor, we see a lot of unskilled delivery. And of course, as you'd expect, the bulk of the very poor and moderately poor in our index were indeed delivering babies in unskilled circumstances. Again, there are associations also that we found with antenatal care, postnatal care in some of the cases. And while I'm somewhat cherry-picking some of the data, because not all age groups and age cohorts had associations, this does allow us to really look closely at the data and find out what it's telling us in terms of our learning and the way that we're doing our programming. Again, looking at our 5-country data, this vulnerability index was also associated with skill delivery amongst women 20 to 49 in Bangladesh, Ghana, Nigeria, and Senegal, based on a low p-value. So this association, and as expected, you see from the level of vulnerabilities, low vulnerable and has, of course, a higher percentage of skilled births. Current use of, also from the perspective of family planning, current use of family planning, which is a core SRHR indicator. They were found with the PPI to be statistically associated in all 5 countries. The relationship, however, was only strong based on Kramer's V in one of the 5 countries, and particularly amongst women 20 to 49. There was no statistical association between current use of modern FP and poverty likelihood amongst adolescent girls in Senegal, however. So that interesting dynamic between understanding what's happening with the 20 to 49 cohort and the 15 to 19 cohort is something that we'll continue to look at and continue to understand what's going on. Furthermore, on the SRHR side, we do need to look more at the unmarried adolescents with no children to understand what's happening here in terms of their own understanding of family planning, current use of family planning, and any associations which may exist with poverty or vulnerability here. So I think what we would be looking for in an ideal world, and this is of course an illustrative example, is what's happening over time and the purpose of this tool going forward. Not just by having a baseline assessment of poverty or vulnerability, but the expectation that between our baseline and our end line, there would be a disproportionate improvement amongst our very poor population in some of our indicators. Because we're carrying out our midline for our show project now, we will be updating this to actually show, rather than illustrative, to show in actual fact what the data would look like from the midline and eventually from the end line setting. So this gives you an idea of how we can then implement and go forward and look at it in terms of our targeting. And hopefully, of course, the lessons being learned at midline in order to tell us whether we are indeed disproportionately benefiting those populations. So I think by way of establishing a few lessons, there is little additional time required in adding these questions to surveys. And in fact, many of us already include broad socio-demographic questions in our surveys. It does allow us to little time, and it's not normally very complicated to add these kinds of questions. We do eventually test and learn about our beneficiary population, both in terms of the start point, but also in terms of what we learn in terms of progress over time with regards to our population. And of course, we shouldn't lose focus on those programming decisions. And I think one of the aspects of collecting the data is what's next? What do we do with the data, and how is it eventually used for decision making? And I think that's part and parcel with all of us when we think about our data collection, of course ensuring that it's used for programmatic decisions. Thank you.
Thank you. So we're kind of running out of time, but I have one quick question for you, if you can answer it in kind of 140 characters or less. So you talked about baseline, midline, and end line in terms of the work you're doing. So that's very project-specific kind of language in terms, like everybody in this room, I bet you have done that. So the question is, like, how do you ensure, how are the most vulnerable in your population being reached? Like kind of post-project in a more system-wide kind of perspective?
Yeah, I think it's an important point about, maybe the last point is the focus on programming. So how are we using the data when we learn about our very poor or very vulnerable population, and how do we program for it? In the MNCH and SRH programming environment where we work, we focus a lot on VSLAs, for example, VSLA groups in Nigeria, 100 women's groups, which are very decentralized, which do allow for a focus on very vulnerable women, access to financing, a lot of focus on referrals. There's training on even ambulance drivers. Are they reaching the poorest of the poor? There's support to ministry in terms of outreach activities. So a lot of those aspects which are inculcated in the program, which in principle are reaching the hard to reach. And I think exactly to the point of what the data tells us will give us an indication of how well those are actually reaching those vulnerable women that we spoke about, the widows, the ones in very distant communities.
Good. So are you, like, one of the slides says women 20 to 49. Are you reaching or trying to reach younger women, adolescents?
Yeah, and I spoke about the 15 to 19, didn't always have the same, I was cherry picking some of the data as the data folks often do, but where there is no statistical association, we have to look back and understand, is there something unique for that 15 to 19 cohort? We are collecting data on 15 to 19. The unmarried without child, 15 to 19, is another area that we really need to better understand in terms of our link to SRHR indicators and vulnerability or poverty. But absolutely, the 15 to 19 cohort is there, but it didn't always have the same statistical associations.
Right. Thank you. So Peter, over to you.
Hi. A colleague told me that I should also be defending Canadian spelling. But in my defense, the title is a riff on Michael Pollan, the American journalist's book In Defense of Food, where he demonstrates that we can eat well through following a few simple guidelines. And the same with data. We can manage our data well through a few simple guidelines. I've talked in places like this before on this, and if you've heard me, I can talk for hours to get to this point that data management is hard. We collectively manage our data often quite poorly, with things from trivial where you can't read what was written, so a record has to be discarded, all the way to losing data files irretrievably and having spent months collecting data that nobody any longer has. It's a big problem, right? And I think if you're here, you probably know that. So I want to talk a bit about how we can, one way maybe we can manage our data a little better. And so with CARE Canada, I've been working over the last 8 months or so with DHIS2. DHIS2, as it says, is an open source software platform enabling governments and organizations to collect, manage, and analyze data in the health domain and beyond. So DHIS2 is apparently used by national health systems in those countries shaded blue, and at a pilot level in those countries shaded green. If any of you work with national health systems in any of those countries and know that to be true or not, I'd be interested. But it is widely used, increasingly widely used, and can be a powerful tool for improving the way that we manage our data. Very briefly, with Clarissa, is anyone here from CARE? How do you say your last name? Teixeira, then. Okay, Clarissa Teixeira from CARE Canada. In CARE's GAC funded projects, GROW in Ethiopia and SANI in 4 South African countries. And this on screen is a sample for one data entry template that has been developed for the projects. It's the same as you might have on paper, but now the data are entered either on your mobile device or directly onto a computer, where they're then uploaded to the cloud and become immediately available. So it's the same sort of questions that you might have in any data collection tool. Here it's, how many people were at the meeting, who was at the meeting, what did you talk about? That sort of stuff that you may want to collect and you want to know, and you don't want to have it sitting in your file drawer for the next 2 years until you get to the point where you have to produce a final report, but you want to be able to use those numbers as soon as possible. So as soon as the data are entered, they're uploaded and become accessible to whoever has been given access to it. And so actually up to that point, this is standard data entry, but the power of DHIS2 comes when you get these, the dashboards, which, and this is made up data, it's still in the development stage, but you can display things, have access to things like number of children in household by participants, or the percent of active mother-to-mother and father-to-father groups. And those sorts of dashboards can be created, customized for whatever the purpose is, for whatever your interests are, and the indicators that you're most interested in. You see or if you can see the subheading Ethiopia, but you can actually drill down. The power of DHIS2 is that you can aggregate data at any level in your geographical hierarchy. So if you have data at the health center and you work in the health center and you want to know what the data are like at the health center, you can drill down and see what is happening in your health center. If you're a regional manager, you can go up one level and see the same indicators, the same graphs, but at a regional level. And then up to provincial or state or national or global level. And it is quite easy, once it's set up, to get all these different levels in the geographical hierarchy. And it can be easily shared between the different levels of management. So it's really clever and beautiful. Some of the benefits and challenges, it's open source, right? So it's free. Well, you have to pay to host the server and to set up the server, but the software itself is free and is well supported by the University of Oslo, and there's a strong and growing development community. And as I said, it facilitates the data management, so you can see at different levels, different different indicators, different levels in your hierarchy, share it between different people, comment on it, share your comments, share your interpretations. It's easy to report at any level in the hierarchy, and it puts data in the hands of decision makers. And perhaps most importantly, if it is used by the national health system, then it gives the opportunity to integrate our work with the national health systems. And maybe not today, but eventually. Wouldn't it be great if we built to one health system where we don't have multiple times collecting the same data, but can share between NGOs and health systems and various stakeholders? So that is not yet a benefit, but it's a huge potential that we see. Of course, there's challenges as well, including that it's open source. So there are some, and as a new user, you find, I must be doing something wrong. You spend 3 days trying to figure out what you did wrong. You know, maybe it needs 2 brackets, or it needs a comma, or what am I doing? And then you find out later that, no, it's just a bug in the system, and you put it out to the community of developers, and somebody may eventually fix it or not. So it's, you know, open source. That's the nature of open source. A greater challenge is it's very lengthy to set up. I could do, with something like ODK, could set up the forms and the analysis software in maybe a week. And with this DHIS2, it's taking hundreds of days for experts. Like Logical Outcomes are providing the support, and they do this full time, and it takes them hundreds of days to set up, or over 100 days to set up. But if you do, then you have those benefits where you can share the data at all the different levels in the hierarchy. The data are stored forever. You won't lose them. And the code for understanding, you know, whether the check mark means yes or no, will always be there. You won't lose that. So it can be powerful. So it's a, the cost-benefit calculations have to be done, whether that setup time is worth the benefit that you get from it. To realize those benefits, there's learning curve for data entry and management, but that's, you know, any new system, so that's not a problem. But perhaps a bigger issue is decision makers must know how to interpret data. And I think we may collectively overestimate our own and our colleagues' numeracy and graphical literacy. I think as the data geeks, and I'm not an inner, it's not an inner geek, I'm an outer geek. This is, we need to do a better job of making sure, I can produce these beautiful graphs, but if decision makers don't understand them, we've missed the point, right? No, it has beauty in its own, but the real point of being understandable, we need to get there. I'm going to skip that. There is this seminal paper in 1985, you see the title there, where they studied how well numerate, literate, educated people can extract data from different types of graphs. And it roughly, the ranking of the ability to accurately interpret goes from scatter plots, where we generally understand scatter plots well, down to heat maps. So heat maps are when you have, oh yeah, this is in DHIS2, it does this very well, where you can have your regions set up, so each health center, say, is a different color, and the ones that are functioning well are red, and those that are functioning poorly are green, and those that are in between are yellow, and then you maybe want something, you know, an orange between the yellow and the red, and so on. Apparently, we don't interpret color as well as we think we do, and we don't do a good job of heat maps. And then pie charts, you've probably seen poor abused pie charts that have been, you know, where the total doesn't equal 100%, for example. You know, they're, so our ability to use them, I think that the data community needs a better job of understanding the capabilities of the users and improve our ability to communicate. And, sorry. I want to devote the last minute of the, I don't have a minute? Okay. I thought I was going quick, sorry. This paper published last week by Tis Burma in The Lancet, Monitoring Country Progress and Achievements by Making Global Predictions is the Tail Wagging the Dog. And he wrote, globally, considerable investments are being made in advanced statistical modeling, computation of uncertainty ranges, and the production of compelling visualization of results. However, these advances could give the impression of abundant evidence that is actually based on very sparse empirical data. Unfortunately, global public health experts and academics are often oblivious to the limitation of these estimates and regularly overinterpret the numbers, especially if the estimates support their arguments. So there's a call for defending data, for getting more data, because a lot of what is, the global estimates of child mortality are based on a whole lot of modeling without a lot of data supporting it. We need to contribute collectively to those efforts. Thank you.
Thank you, Peter. I could see your level of excitement kind of rise up there towards the end, so that was cool. But you kind of scared me off a little bit when you talked about taking like 100 days to set up this thing. So basically what you're saying, once you're in, you're just married to it, or?
Well, I think maybe I should ask, CARE could speak for themselves, but if that you spend those 100 days and by the project end in 2020, then it's discarded, never used again, then it's been a waste of time and effort. But as the organization learns it and learns how to use it and increases its use throughout the community, throughout their community and then the wider community, then those 100 days investment is small compared to the potentially big benefit you could get from it.
Yeah, that makes sense. Okay. Vaughn, over to you on the big picture.
Thanks, Ibrahim, and good morning, everyone. A couple of weeks ago, I was at a data festival in the UK, and before you asked, yes, there is such a thing as a data festival, and there were a whole lot of PowerPoint presentations. I started my remarks on a panel discussion by saying, my name is Vaughn, and I do not spend enough time or resources on the analysis and use of data. The rest of my panel members stood up and said, we're here to help you, Vaughn. And I felt, it was a really warm feeling in the room. It was great to have that level of support. I don't always have that level of support in the department, and I'm going to talk about why that is. 4 things I'd like to cover this morning related to data to inform decisions. First, the policy context. We've heard a little bit about it this morning. I'm going to talk about it some more. Second, where do we get our data? Third, what do we do with our data? And fourth, and I think most important, how can we do better? And we need to do better. There's no question that there is a lot that we can do to make better use of data and to have a better analysis of the data that we do have. Let's talk about the policy context. 3 high-level policies are driving our need for data to inform decisions. And I have to say, just at the front end here, this is probably one of the most positive contexts that we've had in many, many decades in terms of the focus on the importance of data and the importance of doing better with respect to that data. First policy drivers, the SDGs. And you heard about this a little bit already. Focused on results rather than inputs or financial allocations. Include specific targets and indicators under each goal. I think there are 169 targets and about 230 indicators. Before you get too excited, there's a lot of work still to do with respect to that. They're still very much in flux. Targets look a whole lot like indicators. The indicators can't always use all of them. We're seeking to align as best we can, not only our programming, but our results and indicators to those SDGs. And there's some important reasons why we need to do that, not only in Canada, but across the donor spectrum. Second key policy driver is very much Canada-centric, and that's the results and delivery agenda. And this is a really, really key driver for us right now. It's a government-wide approach led by the spouse of one of your speakers from last night, Justin Trudeau. Evidence-based decisions is a key focus of that agenda. Timely data to assess progress and inform course corrections. And this is really, really important. This isn't about waiting until year 4 or year 5 to say, are we on track? This is about from day 1 having in place the metrics, the processes, the systems to assess, are we on track and what are we going to do about it? Because the best time to come to that realization that we may not be on track is in year 1 or year 2. If it's year 4 or year 5, it's too late to make any significant course corrections that are going to make a difference at that point. So constant use of data is one of the key elements there. I mentioned government-wide. This is not only about international assistance, this is about the entire government of Canada making a major shift in terms of the use of data. So very positive context for what we're talking about this morning. Third key policy driver is the feminist international assistance policy. You've all heard about the 6 thematic focus areas, but there's also a really important focus here on measures to improve how we deliver international assistance. This is the first time we've had an international assistance review or aid review in which the focus has included delivery, the how, not just a focus on the what. And so this is a really key opportunity for us to look at our systems together. And I say together because it's not just about the department, it's about our partners as well, and say, how can we do better? This reflects input that we received from staff and partners during the International Assistance Review with respect to how we should work differently together, with respect to how we need to streamline processes. We've got a lot of work to do in that area, and with respect to how we report on progress. Clear direction emerged from that with respect to the importance of the use of data and evidence to inform project design and implementation. Really important to do both, and I'll come to that in a moment, to assess progress and to communicate success. Sources of data. Where do we get our data? Good news and bad news in this area. We've got a lot of data from international sources that we can rely on. That's pretty credible. World Bank, regional banks, UNDP, WHO. There's great macro level data from those international organizations and global indices. Tends to be fairly up to date, although there are time lags on some of them. But it's pretty reliable data. We obviously have project-specific data as well that we use, collected through surveys from our implementing partners, in some cases coordinated with local partners, but only in some cases. Less often do we get data from other bilateral donors and from our country data systems in developing countries. In terms of other donors, we do not have harmonized data collection systems across donors. That creates a huge burden. First, with respect to the fact that each of us has our own data collection systems that we're paying for. Second, we're providing a huge burden to our country partners because each of us is independently, through each of our projects, going to our data, going and seeking data from our country partners and basically saying, can you give us information on this? Can you give us information on that? And what we're asking for is slightly nuanced in every case. So it may actually be the same information we're looking for with respect to access to education for girls, with respect to access to modern methods of contraception for women. There's a whole range of things that we're looking for, but the nuances in terms of what exactly we're looking for will change in every case. That's got to drive our country partners crazy. In terms of country data systems, problems with the data availability and quality. 44% of countries lack comprehensive birth and death data. Makes it really tough to have comprehensive numbers if you're not even sure of the number of people that are in the area that you're dealing with. In most developing countries, census data is available once every 10 years, if at all. When I was working on international financial institutions, one of the banks proposed poverty headcount as a basis for the allocation of concessional window funding. And these are big amounts of funding that we're talking about allocating. Sounds like a good idea. Shouldn't the number of poor be a key consideration with respect to how you allocate funds? So it made sense. With one really key problem, which is across the region, the countries that we're going to be looking at this information for the allocation, there was no population or poverty headcount data in about half the countries. Simply didn't exist. In the other countries, it was about 15 years out of date. So we're going to be making decisions either on the basis of no data or on the basis of data that, frankly, was no longer relevant. Because, again, in these countries, population numbers are changing significantly on a regular basis. And populations are moving even more frequently. To make it more interesting in terms of those country systems, if we look at what donors are doing in this area, 0.3% of funding is devoted to improving statistical capacity of developing countries. It's a very small percentage of what we do. And again, if we're not demanding information through those systems, we're not creating that incentive or that impetus for more investment to take place, either from donors or from the country partners themselves. Use of data. There is some good news here. We use results-based management of processes very effectively during the planning of our projects. Proposals from partners and approval memos from staff highlight data, include logic models and performance measurement frameworks, and assess results and provide mitigation measures with respect to risks. So this is good news. It's clear that data informs our project approval decisions. C'est vraiment une chose très importante pour nous et pour nos partenaires.
It is very important for us and for our partners because we work on a very positive way.
It's positive news, though, and that has to do with the use of data during implementation. We're not as strong here. Baseline data is not always readily available. Project reporting is often input and activity focused due to incentives related to the disbursement of funds. Money drives. And we see that it's really important to justify that we've spent the money, that we've got a need for more money, and that activities have taken place which provide evidence for the use of that money. But those are activities, those are not results. Monitoring of results and risks is very uneven. We can have a great risk management framework at the front end of the project, but if we're not managing those risks, identifying new risks that come on board, taking steps to mitigate those risks, is all of that work that we put in the front end actually being put to good use. Talked earlier about the importance of looking at things such as delays in project startup. If we spend a year or two doing a fantastic plan with respect to that project, but then it takes us a year or two to actually put it in place, in a context that's incredibly unpredictable and in transition, is that project plan actually still valid by the time we start our project? And is it still valid 2 or 3 years into the project, which is about 5 or 6 years after we actually did that plan? Information is not available nearly early enough. Again, I mentioned earlier, if we're talking about course correction and we're not getting that information on results until year 4 or year 5 of the project, it's too late to make a difference with respect to that project plan. And this then speaks to the issue of culture. We put so much in the way of resources into that upfront plan that we want to stick to it. We're proud of that plan. It's important. We've done a fantastic job. We don't want it to change, because then maybe we made a mistake in the planning. It's actually not that we made a mistake, the context changed. I've had projects where the partner in the developing country one day just disappeared. It was the Public Service Commission of the country. How could it possibly disappear? But it did. It was no longer there, and we had to shift. We weren't expecting that. Our plan was all based on working with that organization. We've done extensive analysis with respect to the role of that organization, the pluses and minuses of what was going on inside that, and one day it just disappeared. So lots of things we need to look at with respect to how we can move away from that really rigid upfront planning process, which we're really committed to, but as a result, we don't want to deviate from it. So that was a slightly bad news. There's really bad news coming up, though, which is with respect to how we use data for learning. We've got a ton of data. We may not use data from country statistical systems, but if we talk about monitoring and evaluation, there is a lot of data and project reports, a lot of data coming at us. The information analysis let's go with the good news here first, does inform decisions with respect to whether follow-on projects are needed and advisable. So we do take that into account with respect to those decisions. But the data is less likely to inform partner decisions. Country partners are generally not involved in the framing of evaluations or the management responses to those evaluations. So how on earth could they have ownership of some of the things that are going on there? Data is also not used with respect to informing the decisions of other programs. If we've done an evaluation of something we're doing in Bangladesh and it's relevant to something we're doing in Peru, the Peru program has absolutely no idea. That's got to change. Country partners, again, if the government of Bangladesh is aware of an evaluation of something we've done in Bangladesh, I can guarantee you the government of Peru isn't, or the government of Ghana, or Ukraine, etc. And we're also not good at sharing this information with other donors who might be doing something very similar, or other developing countries, as I say. There are, of course, exceptions. We had an MNCH evaluation which highlighted the need to better address SRHR and adolescent health, and this advice was reflected in the Feminist International Assistance Policy. So there are examples of better practice that we can point to, but this is unfortunately not the norm. Comment est-ce qu'on peut le faire d'une manière plus...
How can we be more efficient? How can we do better?
We have some ideas here. First, we need to be much more systematic in our collection, use, and analysis, and let me underline the word analysis here, of data. We need to provide better guidance to staff and partners. We've started this process. We have a results-based management how-to guide that we put out on the web about 8 months ago, which provides comprehensive information for staff and partners on how to manage for results. We're currently working on reporting guidelines. I had a draft that I reviewed last week on this that will provide information with respect to what we're looking at for reporting. And let me say, we don't need comprehensive information on everything that's happening on all elements of the projects. We don't need 100 and 200-page reports. What we do need is key information with respect to, are we making a difference? What's the evidence for that conclusion? And what needs to change? And so what you're going to see in the reporting guidelines that we'll be putting out is they're far less focused on the activities, they're much more focused on the outcomes, and they're very focused on the question of, are we on track? Do we know that we're on track? How do we know that we're on track? And what are we going to do if we're not? That's the information we need to know in a very concise form, because if you're a country program director and you've got 20 or 30 projects, each of those projects is giving you a 100-page report. I've been a country program director. I'm not reading all of that. There's no way. And if I'm a director general or an ADM for that branch, and my project, or the deputy minister, and my portfolio is 2,200 projects, each one is giving me a 100-page report. There's no way I'm even going to look at that. There's not a chance. There's not enough hours in the year. So concise information that tells us that key information. We're also coming up with new monitoring guidelines. Our sense is that that will provide a good sense of how we can do this better. Online courses that will allow not only staff but also partners to have a common base of understanding with respect to what we're looking for. Methodology notes with respect to indicators that will define terminology so that we have a common understanding of what it is that we mean when we say access to or national standards. Better processes as well with respect to data collection and reporting. We started something a few months ago called the Task Force on Improving Effectiveness. It's a task force I chair, and it involves partners and global affairs staff identifying issues where we need to do better and coming up with solution teams that will identify within a 2 to 3 week period quick wins in terms of process changes that the department can implement quickly. Recommendations from partners. This isn't consultation, this is brainstorming, where partners are coming up with ideas and telling us, this is something we can do better, let's move on this quickly. We've already had 4 of those solution teams in the last couple of months. We're seeing some really good results from that, things that we are acting on right now. Last point I'll mention here, better systems. We need standardized indicators to increase the consistency of data collection. We have now an approved set of high-level indicators from the minister that we're going to be using to monitor and collect data with respect to each of the action areas in the Feminist International Assistance Policy. And we're going to be coming out with those publicly shortly. We need to do better in terms of measuring portfolio alignment. We're going to be coming out with some data with respect to that shortly. measuring policy commitments such as 50% of bilateral aid to sub-Saharan Africa, the 15% marker with respect to programming that is specifically targeting gender equality and the empowerment of women and girls. And then finally, we need a searchable data platform that can aggregate and use project data to assess and demonstrate progress. Believe it or not, we do this manually at this time. 2,200 projects across all the action areas and all the indicators, and we sit down with a calculator and try to add it up. It's 2018. We can do better. But you know what? That is better than where we were last year, because last year we didn't even have indicators that we were trying to aggregate. So progress, but more to do. Actually, I'm going to mention one other thing just before I close, and that is the use of country data systems. If we can use that more as a donor community, I think that demand will lead to improvements with respect to country data systems. If we're not using them, there's no incentive for any improvements in that area. And I think we can do better in this area as well. Forums such as this can bring attention to that. If you make better use of country data systems in your programming, that's a step in the right direction. I know CanWatch has been looking at this with respect to, this came up at an adolescent health conference as well, and also in terms of some of the systems that CanWatch has been putting in place. But I think collectively as a group, this is an area where we can do a lot better. And if we can have reliable, quality data from country systems that all donors can use and all partners can use, wouldn't that be a better place to be in terms of types of conversations we're having today? So I'll close on that. Thank you very much.
Thank you. That was good. I know you saw it coming. I'm going to latch on your bad news.
Sure, go for it.
So very quickly, if you can tell us, like, what concrete steps do you think we can take to better use the data that we have to inform decisions during implementation?
Okay. I mentioned a few concrete steps in my remarks. I think there's a lot more we can do. One of the things I mentioned was the solution teams. We've had 4 underway so far. One was on reporting. One was on contribution agreements in terms of the process for negotiating those. Can we be more nimble and quicker in terms of the negotiation of those to compress the amount of time between approval and actually getting the project going? Another one was on the actual clauses in contributions or in contribution agreements, and the fourth one was on the application process, making that more streamlined as well. We're open to other ideas. If we can do some more solution teams this spring and next fall, I think we can identify some other quick wins. But we want the quick wins to come from the partners as well as from staff. We don't want it just to be driven by us, because you know what you're dealing with respect to our processes. You know how those are working for you and not working for you. We want to hear from you with respect to that, but we just don't want only complaints. We need solutions. Give us the answers. What can we do differently that we can actually move on quickly? So that's one thing. I think the second thing would be incentives and resources. You get what you pay for. In our contribution agreements, we don't pay for reporting. That's considered to be an overhead. Well, maybe that needs to change. And then finally, be more responsive to changes in the project context. So one person liked that last idea. That's good. Less emphasis on upfront planning that we're really wedded to. More nimble in terms of identifying what's going on during implementation and responding to it. If we can do that, then I think we're going to be much more relevant in terms of our programming to the actual needs of the populations we're trying to reach.
You heard that, right? So keep that in mind. So that brings us to the bare knuckle round. So in my hand, I have a list of questions brought to you by the CanWatch Metrics Working Group.
Okay.
Analysts who don't die, but get broken down by age and gender. I would rather not ask these questions. If anybody from the audience have anything to ask, it would be a much better conversation, I would think. So we'll take a couple of questions first, and we move forward. I see here we have 8 minutes left, but I'm going to take liberty to move beyond that because we started 10 minutes late. So, go ahead.
Hi, my name's Peter von Daudelson. I'm at DHIS2 as a platform. The WHO is going to use it for its metadata. It gives you the ability to do real-time data tracking. You can create a learning health system within your project. And they actually, if you pay for the DHIS2 tracker, which isn't open source, you actually can have a health record at whatever level of complexity you want. So you have individual woman or child disaggregated data that can be usable in real time. What's there not to like? As a single funder, as the government of Canada, I live in the UK now, so I'm paying their taxes, but the MRC is funding us to do this work. Why not insist on a singular data package so that you have the metadata that you require to report and to share with other donors?
Mm-hmm. Okay, Alison.
Yes, Alison Krentel, Breer Research Institute, University of Ottawa. 2 quick points. Just a shout out for qualitative research. And Abina mentioned it earlier. If we're going to talk about continuous monitoring, qualitative research provides us a great platform to listen to communities, to our stakeholders, to understand where we need to course correct our projects. So there's a lot of qualitative data, and methods are changing all the time. It doesn't have to be heavy, year-long data collection techniques now. I've been using storytelling in a quantitative survey format. There's lots of interesting things going on. So I wanted to just put a comment about qualitative data. The second is I appreciate the comment about being nimble, and it feeds into that continuous monitoring. If we really want to listen to communities, we need to be able to have the flexibility to change our projects halfway through if we're no longer answering the right questions. So thank you. It was a great panel.
Okay. Shall we take one more question? Okay, so go ahead.
Sure. Hi, my name's Colleen Kilty. I'm from Plan International Canada. My question is not for my supervisor who's sitting on the stage, but it's for Peter. Peter, I think all the creative data nerds in the room said amen when you talked about effective data visualization for decision making, so thank you for highlighting that. My question for you is about best practices in building the capacity of local stakeholders to actually interpret good data viz and use it for decision making, and any key lessons that you can share with the M&E folks in the room.
Okay, I guess 2 questions for you, Peter.
Yeah, that's $1 million question, man. Because it's so easy to find the problems, and then what are the solutions? Because when I think about that, it comes back to you want to have a better national education system, so that by the time the people are at the positions of responsibility, they have adequate levels of numeracy and literacy to be able to interpret the data. But that's kind of useless, right? For at this stage to say improve your national education system, and so I don't know, but what I think is responsibility on the producers of the visualization to make sure that it is understandable and does work. And there are, you can test the interpretability of your graphs, and we like splashy, colorful, and without worrying so much about effective. I have worked with some populations where, like, they could look at tables for days and understand tables, but you put that in a bar graph and they're lost, right? And we think, well, come on, it's a little bar graph. What can you? But okay, if that community understands tables and they have the patience to read hundreds of pages of tables, then that's what we produce, even if it's not aesthetically appealing for us. So I don't know if that's not the best answer, and if anyone has a better one, please.
Okay, who wants to take the qualitative one? Because I think that was a good question. Nobody? Go ahead. Good.
I mean, just to say, I totally agree. We need better qualitative research to understand the data that we're looking at. We need the analysis to interpret it. We need the narrative around the data. It's not just about the numbers. It's about the assessment of what we're looking at and what we need to do with that information. And on the nimble, again, just totally agree. We need to have the ability to do that. I think it's about cultural change. I think for both staff and partners, the sense is that we can't change. We can. We don't have to go back to the minister to change an output or an outcome. We do if the overall focus of the project has changed into something totally different. But in terms of trying to accomplish what we had set out to do, what the minister had originally approved, and do it in a more effective way, the minister doesn't need to reaffirm that. We've got the ability to do that right now. We just don't know that we've got that ability, and we're not taking advantage of that in terms of being nimble. So I think that's a change which we don't have to spend a lot of time thinking about. Let's just do it.
Mm-hmm.
I actually have a question for about the qualitative. I find if I need an expert, especially a young graduate who knows how to do a randomized household survey, I know where to look. And so either like we're in different silos, or the experts in qualitative research in global health are not being produced in Canada. Are they? And where are they? And are they here? Because it seems, so I don't know, maybe we're not communicating because...
Peter, you're not allowed to ask questions here on the panel. Maybe if I can add one, I mean, I agree. So I think that point is apt, and I think there's another panel that's emerging out of this, maybe a qualitative researcher panel in the future, right? One thing that we've found is that I think the two marry very well, qualitative and quantitative. And when you have the quantitative data and you go back to communities and you have that discussion of what's happening in your community with regards to these indicators, and then you have a much richer story coming out of it than just qualitative alone. So there's a marrying that's happening, as well as an interesting story that emerges based on that when you really start to focus on what the data is telling you.
Right. See what you started, Alison? Okay, so let's take another set of 3 questions. If you could identify yourself and fire away.
Julie Savarcha avec CanSFR.
Julie Savarcha with CanSFR. I will repeat the question in English after. A few panelists mentioned the need to break down data by gender, but when we collect data, the gender perspective comes after an afterthought. How can we make sure that this gender perspective is part of the data collection so that we take into account the gender perspective in the project?
A few panelists have talked about the importance of gender disaggregated data, but it often seems that in the collection of data, the gender equality perspective or the gender lens is an afterthought. So how can we ensure that gender disaggregated data or the gender perspective is actually applied during the collection of data so that gender equality is actually part of the program and is an important element of the program? Thank you.
Go ahead.
Hi, I'm Daphna Cohn from Statistics Canada. I have a follow-up question to the qualitative piece, which I think is really important, and it might be ironic, but from Statistics Canada, I will always say you can't understand the empirical information without the qualitative. So a follow-up point to that for Rudy's presentation, I think it's an excellent opportunity to put in some qualitative information for those non-significant findings that you were talking about but didn't show, and I was disappointed not to see them because often non-statistical significant findings are very informative. So, don't just look for the statistically significant differences. My other question is around, in the area, in our current environment of Facebook and OCAP principles for Indigenous research, which is no data about us without us. I'm wondering about the open source data and consent and confidentiality around that.
Oh, okay, these are hefty questions. Who wants that? Let's start with Julie's question. Who wants to take that?
I think with gender disaggregation, one of the things that we've talked about in our programming is we put that in to identify differences. But again, I feel like it always ties back to digging deeper on the why. As much as you have that observation of distinction between gender, and we can easily make sure our sample sizes are able to identify those differences, but then the discussion on the qualitative as to the why, and digging deeper on that end is really the key to ensuring that we're not paying lip service to gender inequality and issues, and really now understanding what are the crux of those issues and adjust our programming accordingly. So I think we're still leading back to the marriage between that quantitative and qualitative in order for us to really impact on the ground what we're doing.
So, and let me add on that. So one of the key things that kept coming up at that data festival I was at was, how do we make the invisible visible? If we don't have statistics that identify those marginalized groups and what those groups are facing in terms of challenges and barriers, how can we provide or work towards solutions? We can't. So the data disaggregation is critical with respect to that. We can't work towards gender equality and the empowerment of women and girls if we don't have data that tells us what's going on and whether we're actually making a difference with respect to that. So I think this is key. Every one of the indicators that the minister just approved for aggregation to give us that higher level sense of what we're doing speaks to the importance of gender disaggregated data. And so we're going to be looking for that, and you're going to see those in the reporting guidelines as well. Now, one caveat on that, which is there will be contexts and there will be situations in which we need to be very, very careful, and this speaks to the second question with respect to the question of confidentiality. Because if that data is not, does not provide a degree of anonymity, then we could actually be putting at risk those marginalized groups in certain country contexts where the disclosure of information could actually identify certain traits or certain characteristics of people that could get them into legal difficulty or result in them being further abused. And so we need to balance the gender disaggregation with making sure that we're taking adequate measures with respect to that data to protect the people that we're actually trying to help.
Did you want to add?
Oui, je vais juste ajouter un point par rapport à notre collecte de données.
Just one point regarding data collection for the hot projects. Particularly, we do a data collection with households, women, and male partners in all cases. That's roots of our data collection, and there are there's a few very fascinating aspects to decision-making within households and men, and what men do to support women in all decision-making throughout delivery and so on. So those are very important data. And then talking about data usage, we were able to draw a few associations to see what is the gender aspect in decision-making by women and decision regarding sexual and reproductive health.
A quick thing, so DHIS2 is open source, it's not open access, right? So the data are as secured as any other cloud-based, so there's still the risks of hacking, and so all the same cautions need to take place.
Thank you. I am really sorry I have to end it here, otherwise I'm going to be in trouble. Sorry, thank you very much.
Merci beaucoup pour cet excellent panel.
Thank you very much for this excellent panel.
Very much. We've really realized how much we need them to during this panel. Thank you very much.